Hello, Professor Fischer. Thank you very much for your presence in Romania with the occasion of World Federation of Neurosurgical Society Symposium, Cerebrovascular Disease, a Multidisciplinary Approach. What is your impression after these years of collaboration with Romanian practitioners and scientists?
Well, as you know, I've been to Romania a number of times over the last 8 to 10 years. This is my first visit since the pandemic, so I don't think I've been here for 3 years. I think that there's a lot of very enthusiastic doctors and other healthcare professionals in Romania that are trying the best they can to improve the quality of stroke care and the availability of acute stroke treatment. I know Professor Marciano is trying very hard to develop a organized, coherent national plan for stroke, and I think this is something that is clearly needed. I haven't yet talked with him about the current situation as compared to how it was several years ago. But my suspicion is that there's still a lot of work to do in educating the public about stroke warning signs so they know when to seek medical attention, and also in improving the availability of the treatments that we have for acute stroke, which are thrombolytic therapy to dissolve blood clots, and what we call thrombectomy, which is a procedure to take the clot out. Those treatments are actually quite effective, and it's important that the people in Romania, when they recognize that they're having a stroke, get to the medical facility as soon as possible, and then hopefully have the treatments available to try to improve their outcome.
All right, thank you. And at the top of the World Stroke Organization strategic model is the vision of the organization towards a life free of stroke. What are the most important instruments at hand that the World Stroke Organization needs to take advantage of to accomplish its mission of reducing the burden of stroke?
Well, as you know, and I guess the audience should be aware of, I'm currently serving as the president of the World Stroke Organization. So in that capacity, I obviously have a lot of information about what the goals of the organization are and how to achieve those goals. The organization has grown substantially over the last 5 to 10 years. It's encompassing a multifaceted approach to reducing the burden of stroke around the world. And it really is a world organization that focuses on the situation for stroke in many, many countries. Advanced countries, middle-income countries, lower-income countries. And we have a number of different ways that we're trying to reduce the burden of stroke as much as possible. So one is to educate the public about stroke, the warning signs, and what they should do if they think they're having a stroke. We also obviously interact with healthcare professionals, and that includes both physicians and allied health care practitioners, like therapists who do physical or occupational therapy, speech therapists, nursing, and many, many different kinds of disciplines. To enhance our educational effort, we have what's called the World Stroke Academy, which is available to the healthcare professionals who are members. And there are 2 webinars a month on various topics. Important papers that come out are evaluated, and critiques are provided to people when they want to look online. There's a large social media presence various social media platforms like Facebook and Twitter. So for younger people, that's what they use to gather information. It's there. We also are involved with a yearly conference, which is coming up next month in Singapore. We also collaborate with regional conferences in various parts of the world to provide speakers. We endorse the meetings and give feedback about the content. We have something called World Stroke Day every year, which is at the end of October, so it's coming up this year on October 29th. And there are a wide range of activities in many countries around the world to enhance the public's knowledge about stroke and what they should do if they think they're having a stroke. So those are the things that I remember off the top of my head, and I'm sure there's many other things that I'm not remembering. We have a website, obviously, that people can take a look at and see all the wide range of different activities and services that we are involved with. I should also mention that the organization has members, but we also have organizations, stroke support organizations in over 70 countries that are affiliated with WSO. So we work with those affiliated national stroke organizations to help them fulfill their missions.
All right, thank you very much for the insight. And a further question would be, how can World Stroke Organization help treatment-related stroke developments in Romania?
Well, that's a good question. Obviously, I'm not exactly sure what we're doing here right now, but we certainly would be interested to work with the Romanian Neurologic Society and the Stroke Society here to help with educational material and whatever other resources that we could provide that will help enhance stroke care in Romania. So as I mentioned, we have lots of educational material that could be shared, and I think part of what I'm doing here this time is to talk with Professor Murciano about how to better have the interaction with the WSO and the appropriate organizations in Romania that are involved with stroke care.
All right, thank you. And my last question would be, what is the relationship of COVID-19 and stroke?
So that's an interesting question. It was a big issue when the pandemic first started. So back in the spring of 2020, when things were really starting to get bad, what happened in the United States, which I can speak obviously the most appropriately about because that's where I practice, what happened in my hospital in Boston and many hospitals around the United States, there was a huge influx of COVID patients with infections. And that had a substantial impact on what else the hospital could do. So for example, elective surgeries were stopped because the hospital needed the beds to take care of COVID patients. Outpatient clinics were suspended. So we didn't do any outpatient clinics in person. We only did virtual for 3 months. And then we also saw initially that stroke patients were not coming to the hospital because the number of stroke admissions at my hospital, Beth Israel, and also the other large hospitals in Boston significantly declined. And we think that the reason for that was that patients who were having a stroke were afraid to go to the hospital because they were concerned that they would be exposed to COVID. in the emergency room and potentially in the hospital as well. So there was a quite substantial decrease in the number of stroke admissions in the initial phase of the pandemic, and then within a couple of months it was back pretty much to where it had been before. So that was an interesting development, which I've been practicing neurology for over 40 years and obviously taking care of a lot of stroke patients during that time. We'd never seen anything like this before. The other thing that we learned was that there was a relationship between COVID and stroke, so that there were mechanisms of disease related to COVID that predisposed people to getting strokes. And this was fairly extensively reported in the literature, that some younger, especially younger people who normally wouldn't have a stroke very commonly, that there were younger patients having COVID infections and then getting a stroke. So that was something that we saw. And then we also saw not only the typical strokes, but we were seeing what's called venous strokes, because normally the stroke happens because of a clot in the arteries, not the veins. But there was a group of patients that, because of their coagulation disturbance from COVID, they were getting venous clots, which cause a different kind of stroke.
All right.
And then the last thing I'll mention is that I was involved with a group in China, and we published some papers that I helped them write about the experience in China when the pandemic first started there. And there was a similar kind of thing that happened where there was a significant decrease in stroke admissions, and then as the pandemic started to taper down, then this number of patients that were coming to the hospital increased. And we actually, at the WSO, did a survey of the experience in many countries, and there was quite a variation of what happened. But most places did see a decrease. And there also a big change in their outpatient practice. So a long answer to, because it's a very complicated situation.
I believe so. All right. Thank you, Professor Fisher, for your insight
Okay,
into the
well,
matter
thank
of
you.
stroke, and thank you for being here.